Hello and welcome to this short training program on scars and scar treatment. Scars, we all have them. Some we can live with, others we would definitely rather be without. So what causes scars and how can we treat them? Well, scars are the result of an injury or a wounding of the skin. And when the skin is wounded, nature's priority is to heal that wound quickly, not perfectly. As long as the wound is open, we're of course exposed to the dangers of the outside world, so speed is the priority. That means that we end up with something called scar tissue. Now, scar tissue isn't like normal skin. Normal skin is well supplied with blood vessels, with nerve endings, with sweat glands and so on. Whereas scar tissue is quite different. It lacks the normal blood supply, it doesn't have the usual nerve endings, it doesn't have the sweat glands. So it looks and feels different to normal skin. It looks paler, it doesn't have the same range of sensation as normal skin, it doesn't sweat like normal skin. So scar tissue is very obviously different, and therein lies the problem. The amount of scar tissue depends on the healing process, and sometimes it can go too far and we end up with too much scar tissue, which causes something that we refer to as a hypertrophic scar, which is a scar that stands out from the surrounding skin. In its most extreme form, it can lead to something called keloid scarring, which is lumps of flesh that literally sit on the skin. And these are not very nice at all. They can be quite disfiguring. So that's scar tissue, that's how we end up with it. What can we do about it? Well, the world's experts tell us that there's really only one way to successfully treat scars, and that's silicone. There are two organisations that are world-renowned in this area. One is called the International Advisory Panel on Scar Management. It's a grouping of the world's leading experts on the treatment of scars, mainly plastic surgeons. And they did a very thorough and exhaustive review of all the clinical evidence. They published it a few years ago, and their conclusions were quite straightforward. They said that there's really only one non-surgical way that is clinically proven to treat scars, and that's silicone. The other body is the American Academy of Dermatology. They also did a thorough review, published their findings a few years ago, and they came out with the same conclusions, that there's only one clinically proven way to treat scars, and that is silicone. They went a bit further and they looked at some of the other technologies, and in particular they focused on vitamins, vitamin A and vitamin E, which are used in quite a number of popular so-called remedies for scars. And their conclusions were quite straightforward. They said that the use of vitamin A in scar treatment is not recommended, and the use of vitamin E in the treatment of scars topically should be discouraged. The reasons for that are that the clinical evidence, such that it is, shows that there is no benefit to using these vitamins topically to treat scars. There is no proof whatsoever that they do anything, and in fact a few studies have shown some adverse effects as a result of using them. So their conclusion is, don't use vitamins A and E topically in the treatment of scars. What we should be using is silicone. And silicone comes in a number of forms, and I'm going to talk to you now about three products that we have for you. They're all under the brand ScarHeal, and the first one is called ScarFX, and it is silicone gel sheeting. Now, silicone gel sheeting is recommended by both the organisations I referred to earlier as really the gold standard for the treatment of scars. You apply a silicone gel sheet to the scar. It's adhesive, it sticks to the skin and the scar, and it forms an occlusive environment. Now, what do we mean by this? Well, occlusion has the effect of preventing anything from entering the skin or from leaving it. So oxygen, carbon dioxide, etc. Cannot enter or leave. So the result of that is that the skin becomes hydrated, which means that cells within the skin can move around more easily, and this helps in the remodeling of the scar tissue. And the other effect of occlusion is to reduce the number of blood vessels, and by doing that you reduce the tendency for overproduction of collagen, which can lead to hypertrophic scarring. So occlusion using silicone gel sheeting has been shown clinically time and time again to be really effective, and is the only clinically proven way of reducing or improving the appearance of a scar. The second product I'm going to talk about is ScarHeal liquid silicone gel. You apply this gel by massaging it onto the scar, and it forms a film over the scar, which is invisible, it's non-tacky, and it's very, very quick drying. So you end up with this invisible film which forms an occlusive barrier in the same way as the silicone gel sheet. And by doing so you are achieving the same effect, but it's particularly useful for areas such as the face, where you don't really want to have sheets of silicone gel all over your face, and perhaps areas like movable joints where silicone gel sheeting might not be so easily to conform on the joint, or may not stick so well. So liquid silicone gel is great for those sorts of areas. So ScarHeal is fantastic for people with acne scars. Acne scars are little pits all over the face as a result of acne, and ScarHeal is ideal for the treatment of acne scars. The third product I want to talk about is ScarAesthetic Scar Cream. Now this is a cream as well as silicone. It contains 22 other proven ingredients that help to improve the appearance of scars, and it's able to do a number of things. It can protect the skin against damage by free radicals, for example. It can lighten discoloration, even out skin tone. ScarAesthetic is also great for lightening skin blemishes such as brown aging spots, etc. So it's a great product in its own right. It's wonderful for stretch marks, because stretch marks are essentially a discoloration of the skin in a sort of striated manner. ScarAesthetic is great for evening out the skin tone and getting rid of those discolorations. And it works particularly well with ScarFX silicone gel sheeting. In fact, the two used in combination have been shown to improve scars, even old ones, by up to 82%. The usual way of doing this is the ScarFX silicone gel sheeting is worn at night, and the ScarAesthetic Scar Cream is used during the daytime. Now, we've combined the two to produce something called a cesarean section scar healing kit. That contains a sheet of silicone gel sheeting, ScarFX, which is ideal for the C-section scar. It's the right shape and size, and a tube of ScarAesthetic. And this combination really is the very, very best way to treat any hypertrophic scar, and in particular in this case scars that result from caesarean section. So highly recommended for that sort of application. So there we have it. We have three different ways of using silicone, but all three are highly effective in their own right and can be used in combination.